One of the important points of the WBMT is to help people which are doing transplants, but also which are not doing transplants, to establish their program or to optimize their program. So the Ukraine asked the WBMT to help them to make allogeneic stem cell transplantation already in 2021. And after a visit, a local visit, we found that they have the instrumentarium to do this. And we started by the end of 2021 to make conferences with them, and also to make daily supervisory telemedicine. So that means that we are every day, excluding Sunday, we are looking at the patients together, and we're looking at the results of the counts and so on, and helping them to do the transplant. And this then, after the war, we continued this, despite the war, I would say, and we have done in last year, during the war, 223 transplants. And what is more important is that mostly of them were adults, which were not done before. And this was only one way. And how we did this is we collected, first of all, the essential medicines which they didn't have. We made a list not only for one hospital, but for all 8 hospitals which are doing transplants. And there was, for example, the city of Leipzig gave them 1 million worth of medicines to make these transplants. But with the list now is in different locations to have some donations for them. The second point was that we made a list of patients in need for a transplant. And the question was always, should we make the transplants outside the Ukraine or inside the Ukraine? And most of the patients actually wanted to be inside the Ukraine, will not leave the country. And this is quite remarkable. And therefore, we did not evacuate these patients, but we rather give the tools to the doctors in the Ukraine to do the transplant themselves. And we are quite proud about this, because especially also the diagnostics have improved considerably since material from these patients were sent to Munich and were actually performed there. And so there is no quality difference about the diagnostics. So we are still working on this, and we are hoping that, first of all, that the war is finished soon, and secondly, that we have given tools for sustainable transplant activity in the Ukraine.